I'm also the creator of Cooking for Boards on Instagram. The Jewish Orthodox Women's Medical Association, also known as JOWMA, is a nonprofit organization whose membership includes Jewish Orthodox female physicians and trainees. We created JOWMA Wellness with the goal of providing medically conscious, evidence-based recommendations for everyday living. JOWMA Wellness partners with medical and wellness professionals to create practical education and training for Orthodox Jewish women. JOWMA Wellness will cover topics related to nutrition, fitness, mental health, meditation, sleep, amongst others, to mitigate disease risks and promote prevention rather than cure symptoms. There will be a post-webinar survey, which you will receive after the webinar. Please try to fill the survey out, as this will help us conduct research on this education. Those that fill out the survey will be entered to win an Amazon gift card. I would like to introduce our moderator for tonight, Alyssa Goldwater. Is a CEO, wife, mom, and the digital influencer behind the lifestyle brand, A Glass of Goldwater, at Alyssa Goldwater. Make sure to follow her on Instagram. Merging motherhood with humor. A Glass of Goldwater has become a community and support network for nearly 60,000 women across the world. By having hard conversations about difficult topics such as mental health, body confidence, and the unspoken struggles of motherhood, Alyssa not only keeps people laughing with her sarcastic take on life, but also helps women feel part of something bigger, that they aren't alone in this crazy world.
Hi, everybody. Thanks, Jacqueline. I'm so excited to be here tonight. It's really an honor to be asked to speak, to be asked to moderate, because mental health really plays a big part of my life. And if you follow me on Instagram, you'll know that I talk about mental health a lot. My most recent stint with mental health was I decided that once a week therapy wasn't enough for me. So I decided to participate in something called an IOP program, which is an intensive outpatient program, meaning I went to a clinic every single day for about 40 days from 9:30 in the morning until 2:30 in the afternoon. And I really learned so much about myself during that time. I learned that I wasn't alone. I think that was the most monumental component to the program for me, that there were other people who felt exactly the same ways that I was feeling. And I also learned a lot of tools to regulate my emotions and the experiences that would come up that were tied to my emotions as well. I struggle. I'm a mom. I've struggled with anxiety, stints of depression for a long time, but this was sort of just the dive in that I recently needed to be a better person for myself, a better wife, a better mother. They say you can't pour from an empty cup, and I truly, truly believe that. And so I just want to say to anybody who maybe is taking the first step to learning more about anxiety tonight, good for you. It can be scary, but it shouldn't be. And hopefully tonight we'll be able to, further break down stigmas and answer a lot of questions and just have a really open and honest conversation about anxiety. So first, I would like to introduce our first panelist of the evening, Rachel Tuckman. Rachel is a licensed mental health counselor with over 10 years of experience. She's worked with many diverse populations, including incarcerated women at Rikers Island Correctional Facility, kids and adults with developmental delays, kids with behavior issues, overwhelmed parents looking for skills and support, teens struggling with the pressures of adolescence and life in general, adults going through difficult life circumstances like divorce, infidelity, face of life challenges, and women experiencing infertility. Rachel is a HAES aligned clinician and dedicates a lot of her time out of office to educating parents and kids on the importance of body respect and the behaviors that truly honor our health. Currently, she offers services in her Cedarhurst, New York office for kids and teens ages 5 to 18, adults and women experiencing infertility, pregnancy loss, and post-hysterectomy. Rachel also does speaking engagements for schools, synagogues, and various community organizations. And with that, I will turn it over to her.
Thank you. I always forget to unmute myself. Okay, thank you, Alyssa, for that introduction. And thank you for sharing some of your stories. So I am tasked tonight with just talking to you just generally about anxiety, what it looks like, how to know when it's a problem, some of the ways that we work when we treat anxiety, and just giving you guys some basic information so that you can learn to identify and figure out like when and if anxiety is a problem for you. So I just want to start by saying that anxiety is a healthy human emotion, right? And I think it's important that I emphasize that there's no such thing as a bad emotion. There's no such thing as something that we shouldn't be feeling. Every feeling that we feel, every emotion we experience serves a purpose. So anger fuels us sometimes when we're in bad relationships to leave them. You know, jealousy can serve as like kind of, you know, an insight into like, hey, this person has something that I really want, and it'll like motivate us to kind of prioritize what's important in our lives and maybe start getting, you know, into the goals that we want to achieve. Sadness, you know, it can teach us very, you know, about what's important to us and what our values are. So it's very important for us to really never treat any emotion that we have as like bad and we want to push it away. You know, so anxiety serves a purpose, right? It is fear that protects us. It's a protective factor in our lives, and it's something that's helpful. So again, when you have anxiety, let's say before a job interview, you're going to make sure that you read up on the place that you're interviewing for, that you know your stuff, that you know, have everything prepared before a speaking engagement. You're going to make sure you have your notes and that you've done your research and you know what's up. You're going to really make sure you put your best foot forward. So anxiety really does serve a purpose for us. Again, anxiety also keeps us safe in that, like, we understand that if we cross the street, you know, there's a risk. So that anxiety of like, I understand the world is not a safe place and not everyone's a safe driver. I'm going to look both ways, right? It can become a problem though, when that fear is something that is more than what we would typically expect. So with the example of crossing the street and, you know, our worry of like, okay, we understand not everyone's a responsible driver. If you're terrified to cross the street and you're always afraid that you're going to get hit by a car, and this is something you dream about constantly, and you don't want to leave your house, and someone has to cross the street with you and they have to hold your hands, and you know, whatever it is, and there's a panic attack, that's when we would say anxiety is a problem. The difference between healthy anxiety that protects us and helps us and anxiety that's a problem is that it is intense and it is persistent and it's excessive, and it's worry about just everyday things that we shouldn't really necessarily be worried about. And then sometimes it's things that are very intense. So I can see people that are worrying constantly about losing their job, or like, you know, that something's going to happen to their kids. And then I see people worrying about death or being robbed, or, you know, I see a lot during this pandemic, people being very worried about being sick all the time. And there is something called health anxiety, illness anxiety, which was known as hypochondriasis, that people are constantly afraid, like I have a headache and oh my God, maybe it's a tumor, right? So we know that when it becomes intense and it seems almost, the word irrational is very harsh and judgmental, so I don't like to use it. But when it seems on the outside, like people are like, you're crazy. Like, why are you saying that? If you hear people saying that to you, that might mean that your anxiety is becoming a problem, or if you even feel it yourself, right? And I see this a lot with clients that I have with anxiety. They're insightful and self-aware. So they know my fear doesn't make sense, but I can't stop it. And that's something that I also want to kind of like normalize for you. If you feel like you understand that it doesn't make sense, but you can't stop it, it's not a problem with you, it's a problem with anxiety, right? And that's a very normal feeling, to feel like, I know that it doesn't make sense, and I know I'm okay, but like, I'm so overwhelmed with this feeling. So I just want to go basically through like the biology of anxiety and what it is, what's happening to you. But basically, you know, the bottom of your brain, you have this little like almond shaped thing called the amygdala. And the amygdala basically flags incoming information as a threat. And it sends out, when you're anxious, and it sends out alarms to tell your body like, uh-oh, we got to prepare, like we're in trouble, fight or flight or freeze, run, get out of here, something bad is happening. And I always give like the analogy that's kind of like the smoke detector in your house. You know, so like if you're burning a piece of toast, your smoke detector is going to go off because it's warning you there might be fire, right? Most likely there isn't, right? I'm sure we've all burnt toast and it's smoky and whatever. And we're like, all right, we just fan the smoke detector and it's fine. But your brain doesn't know the difference between actual fire and smoke when it's really tuned into anxiety. So then when you feel this nervousness and your brain sent out this message like, oh my God, there's danger, then your body will start reacting. So your heart rate might increase, your breathing might get quicker, your blood pressure rises, you might start getting sweaty, you might start feeling very emotional, you might start feeling nauseous or dizzy or numb or tingly, or all kinds of different like physical feelings we start feeling when we're anxious. And then if our body doesn't have anything to do with it, right? Because you're not running away from an axe murderer, or, you know, you don't have to stay in place so that the tiger doesn't attack you. Your body doesn't have anything to do with all of this energy. And it can make you feel really horrible. So we want to kind of pay attention to anxiety that feels that way, that we are having these intense physical reactions, and there's nothing really around to make us feel that way. There's another form of anxiety, again, which I kind of touched upon, but I'm just going to throw out some of the forms of anxiety that we see. There's panic disorder, which is, again, when you have panic attacks, which can be characterized by, it feels like a heart attack, chest pain, sweating, nauseous, chills. Again, it's all the anxiety feelings, but a lot more intense. Dizziness, feeling kind of out of body, like you're observing yourself. So there's panic disorder. Selective mutism is an anxiety disorder. Social anxiety, any phobias, separation anxiety. Sometimes anxiety can be a result of a medical condition. So we'll see it a lot, and I'm sure Dr. Mermelstein will speak more about this, but we'll see it a lot in eating disorders. There's a lot of anxiety, substance-induced anxiety. So we'll see that a lot in medical, with medical conditions. And that's something that's important to think about. Like if you are experiencing anxiety, rule out any medical issues like diabetes or heart conditions or thyroid, and kind of make sure that that's not the problem, and then figure out, you know, what mode of treatment you want to tackle in order to deal with anxiety. Anxiety can start in childhood. Most typically it does. Very often I have people that will come to me and be like, yeah, I was never anxious, and like now I am all the time. But when we go back far enough, we kind of start like realizing, no, there was always anxiety there, but your teacher thought you had an attention issue, or your parents just thought you were very sensitive, or like nobody really understood that it was anxiety. So it generally starts in childhood. There's a genetic component to it. So if you have someone in your family that has a history of anxiety or even depression, you are more likely to have it yourself. It's easily treatable, though. That is something that I really want people to understand. With therapy and medications and other forms of interventions, we can definitely help manage your anxiety and bring it to a place where it's healthy and something that's not getting in the way of your life. But left untreated, it can really turn into really more severe issues. And like I said, you know, anxiety disorders like OCD, or we can also see a lot of like physical ailments that come with it, because stress, we know, is not good for our body. So we really want to make sure that if we're feeling uncomfortable about the level of anxiety in our lives, and if you're asking yourself, like, maybe I have a problem, it's probably a good thing to reach out to someone and just ask the questions and kind of describe what you're going through and get an opinion on whether or not you could use some extra help. So when should you see a therapist? When it's getting too much for you, when it's getting in the way of your life, when it's getting in the way of your relationships, maybe even when other people are saying to you, like, this reaction like seems like a lot, right? Hopefully your friends or family are saying it to you in a compassionate way. But again, when it just doesn't make sense, given the context of whatever you're going through, it feels like out of proportion to the situation. If it feels difficult to control, meaning you understand that how you're reacting doesn't make sense, but you can't control it, that's a good sign that you might need some extra help. And again, if it's interfering with your daily activities, so it could even just be, you know, like, it doesn't have to be something as severe as getting to work, but it could be like, it's hard for you to get to sleep at night. You are very restless. You find that it's very hard for you to concentrate or function with your family or whatever it is. That might be a good time to step back and say, okay, I feel like I might need to reach out to someone and find out how to get help. People often ask, you know, when they decide that they want to reach out for help and they've ruled out a medical condition, like, who do I see, a psychiatrist or a therapist? And so I often say, like, you can see both. And sometimes it's important to see both. Sometimes I am like the first stop. It depends. People will come to me first and we'll work in therapy together. And sometimes they find that they don't need medical interventions. Other times when we find that we're getting stuck in therapy, and they're having a hard time implementing a lot of the skills that we're learning, or it's just very hard for them to like get out of their head, and panic is really like overrunning their lives, then they'll go and see a psychiatrist. Oftentimes it might work backwards, that they saw their general, doctor, and their doctor put them on some medication and told them, hey, follow up with a psychiatrist. And then a psychiatrist has them on some anti-anxiety medication. And then they'll say, like, you could really benefit from speaking to someone and getting skills and talking this out and kind of figuring out, what's getting in the way. And so I always say, if you are going to be seeing both, it's so important that both communicate, that your psychiatrist and your therapist are on the same page, that they're coordinating goals for you, that they're talking about whether or not they're seeing the same thing, so that your medication can be prescribed properly, and also that your treatment and therapy with your therapist can be coordinated properly, so that you're getting the care you need. It shouldn't be like, I see my psychiatrist, but my therapist has nothing to do with them. I find in the cases that I work together with a psychiatrist, that's when we see the most success. And this way also, if we decide that a client needs to taper down their medication or eventually get off of it, which does not always happen, but in some cases they do, then we can coordinate together to make sure that it's done in a way that you are taken care of and that you feel good, and that there's no, side effects or any kind of setbacks or any of that. In terms of like therapy, when you're not in therapy, like what can you do in between your sessions? So you have your psychiatrist and you have your therapist. What can I do then when I don't see my therapist, if I'm struggling and, I kind of want to work on things? So I always say it's so important for you to realize a lot of the work that you do is done outside of the therapy room. So it's important to have a support network. It's important to you to figure out ways that you can kind of supplement the work that you're doing. So podcasts, meditations, prayer, if you're a spiritual person, exercise, any kind of movement is so important. And we see there's a lot of research on the benefits of like movement and improvement in mental health. So a walk, vitamin D, being in the sunlight as much as you can is so important. Reading books about mental health and anxiety, and just in general, self-help books are really important. Journaling is a wonderful thing, and it doesn't have to be like a Dear Diary, formal, whatever. It could literally be just on your phone, observing your thoughts, observing your feelings, kind of talking about what you're going through, throughout your day. And I find for me, when my clients do that, it's so wonderful because then they get to see their progress. And because in therapy, progress, it happens in small bits. It doesn't happen in a big, like fantastic whoa moment. So they're able to look back over the months and be like, oh, wow, like I didn't even realize how my thinking was then versus how it is now. Like I'm able to notice when I'm stuck in that like spiral of like doom, or when I'm going down that rabbit hole, or I used to think that way and now I don't anymore. And, wow, I've stopped feeling that way. So I think journaling is such a beautiful way to track your progress, but also just to like get all that stuff out of your head and onto paper. I think that it's important also for us to know what are some things that can exacerbate anxiety. So if you're someone who already has anxiety, or again, even if you're someone who doesn't necessarily, it's important to know that when we're not sleeping properly, when we're not eating properly, when we're not nourishing our bodies, and so we're not taking in enough food, we're not drinking water, that can definitely cause more stress and anxiety. And so I often say to people, when anxiety feels crippling, if it feels like a lot, did you eat today? How's your sleep? What's going on with that? That's important to pay attention to, because those are things that you can pay attention to. And those are within your control that can help really make your anxiety much more manageable. Stress, managing your stress. What is going on? Are you scrolling online all the time? Again, we know, especially now with all of this stuff that's coming out about Facebook use, right? And social media, we know that being online, while it is so wonderful, and there are so many incredible resources out there, and it is so helpful because there is so much, education and information for us, it's a double-edged sword. It can be something that's overwhelming and exhausting and anxiety inducing. So really paying attention to your social media use, your sleep patterns, your stress management, alcohol, if you're using any kind of alcohol or even drugs, paying attention to that, really making sure that you're taking care of your physical health as well, because I often say that physical health is mental health and vice versa. They're not two separate things. So if you know that, you're not taking care of your body, you're going to start feeling it. Or if you're not taking care of your mind, you're going to start feeling it in your body. I just want to differentiate also between stress and anxiety. right? Because people often ask, like, am I stressed or am I anxious? So stress is usually from an external cause, while anxiety is internal. So stress could be because you have financial trouble, or your marriage is on, having, trouble, or you lost a job, or your friend is angry at you. That's usually stress. And it usually disappears after the concern has kind of gone away or the problem subsides. So, things pick up in terms of your job, or your friend ends up talking to you, or you realize you don't want to talk to her, or you guys get into therapy, or things get better in your marriage and you feel better. Anxiety is this persistent, like I said, that persistent nagging worry that just won't go away, and dread, right? It's like this danger. You feel like doubt, but you treat it like danger. Like you're always worried about things like what if, and you can't handle that discomfort, and it doesn't go away even after, let's say, the concern has passed. So, you're nervous about a trip, and then the trip comes and goes, but like you still have this like constant worry and stress about you. Then we say that's probably anxiety. And again, anxiety develops from a complex set of factors such as genetics, brain chemistry, personality, life events. So that's the difference. The symptoms can look the same, stress and anxiety, but the severity of the anxiety symptoms will, can look like a panic attack. And also they kind of happen very suddenly. So it's not like, I'm stressed, I know my job is like horrible and I hate my boss and whatever, like you've kind of been feeling this always. Anxiety will just kind of sneak up on you. And often they interfere with work and your life. And again, if we don't treat it, then it can lead to all kinds of severe issues further down the line. And something that I think is important to, again, pay attention to is some of the more, like I said, holistic kind of approaches to also dealing with our mental health and our anxiety that we have at our fingertips. So again, it doesn't have to be like joining a fancy gym or whatever. It could be a walk around the block. It could be a cup of coffee. It could be a book that you love. It could be calling a friend. It could be silencing your phone or leaving a WhatsApp group or whatever it is. We have to take care of ourselves in whatever way we can. And again, noticing our triggers, noticing the things that set us off or that stress us out is the most important thing we can do to manage our anxiety when we're not in therapy and when we're not seeing our psychiatrist. And so I think that piece of awareness, that kind of acknowledgement of like, what, this feels overwhelming, but there are things that I can do, and there are supports that I can have in place, and there are resources that I can find. And again, even if therapy is not accessible to you at that time, because it is something that is, expensive or a lot of time that people don't have, again, looking at what can I access right now that might be helpful to me. So, following people on social media that discuss anxiety or webinars like this are fantastic resources for you. Thank you.
Okay, thank you so much, Rachel. That was so informative. And I'm just gonna jump right in and introduce our next wonderful speaker, Dr. Hindi Mermelstein. Dr. Mermelstein is an adult psychiatrist with added specialties in geriatric psychiatry and consultation-liaison psychiatry / psychosomatic medicine. She completed her undergraduate degree at Touro College, and she was the first female graduate to go to medical school. She obtained her MD degree at SUNY, Upstate College of Medicine, followed by an internal medicine internship at Beth Israel Medical Center, a psychiatry residency at NYU-Bellevue, and a fellowship in the Department of Neurology at the Memorial Sloan Kettering Cancer Center. She has served in a variety of clinical, administrative, and academic positions and has been involved in a number of community and professional organizations, including JOWMA, and is currently the chair of the Standards and Ethics Committee for the Academy of Consultation-Liaison Psychiatry, as well as the Community Practice Special Interest Group. She currently splits her professional time between her positions at NYU, Northwell, and her private practice. And just quickly, before Dr. Mermelstein starts speaking, just remember to send in your questions to the Q&A, and our panelists will be answering them after Dr. Mermelstein speaks. So with that, I will turn it over to Dr. Mermelstein.
Thank you very much. Rachel did such a good job. I almost sort of think I don't have to say anything more, but I will try because I have 20 minutes to fill in. Just want to, I guess, underscore or reiterate a couple of things that Rachel focused on. One is that anxiety is a normal part of our responses. It is a part of our survival mechanism. I would not have survived going to medical school if I wasn't nervous about tests, if I wasn't anxious about exams. And it is generally, it's related to fear. The amygdala does set up, it's related to fear. It is part of what triggers, I guess, the fight or flight response. And it produces a variety of physical, psychic, and psychological symptoms. And when we talk about treatment from the, I guess, psychiatric or medical perspective, we can talk about some of those things. So Rachel was commenting that there is no emotion that's bad. And I'm going to say that, Steph, I agree, there is no emotion that's bad. The question is whether or not it's normal or abnormal, whether it causes dysfunction or doesn't cause dysfunction, and how much dysfunction or how much dysregulated it can be, and how much difficulty it can cause in our lives, that will determine, or should determine for all of us, what we do about it. It's sort of like a headache. Everyone gets a headache from time to time, but if you have a headache more than once, twice, 3 times a month, maybe, if you have a headache twice, 3 times a week, and you have to lay down, or you have nausea and vomiting, or you somehow or other can't function, or you find yourself taking so much, I guess I should not date myself and say aspirin, you take so much Tylenol or so much Motrin that it begins to put you at risk for some complications from taking too much medicine, then you have to think about whether or not you need to pay attention and get treated for it. So anxiety, emotions like anxiety are just along those same idea. It's not that they're bad, it's not that they're good, it's that they're abnormal in their intensity, in their interference, in what they do to us and how they affect our lives. So normal anxiety, as Rachel said, is in response to a threat, whether it's a threat or potential threat, anticipatory threat. It's how we survive. It's generally proportional to the risk and the threat. So, if your anxiety drives us to study for exams, it drives us to meet deadlines, but it shouldn't be so extraordinary that it prevents us from doing the task at hand. If someone is too anxious about exams, they get so distracted they can't pay attention, and they often do worse than they would if they weren't anxious at all. It tends to be time limited or time responsive, meaning you get anxious about an exam, a normal everyday thing. And then after the exam is over, the anxiety should dissipate. If you find yourself reviewing, I have a patient now whose anxiety is marked by the fact that after every interview, after every speech, he spends 2 or 3 days reviewing everything that he said, everything he thought he said, worried about whether he said the right word or didn't say the right word. That's not normal anxiety. That's not anxiety. That anxiety has gone, it's out of proportion to the issue. It doesn't dissipate, it doesn't disappear, it doesn't attenuate, it doesn't go away with the time. And it impacts and interferes with his life. And he knows it makes no sense, as Rachel said. He knows it doesn't match, but he can't stop himself. It prevents him from going to sleep, and it wakes him in the middle of the night. And abnormal anxiety can be secondary to, that question of nature versus nurture. If you look in the nursery, if you look in any newborn nursery, you'll see some children are more, sensitive or more disturbed by a wet diaper or noise. Some people are less responsive, and some of those inborn traits carry through. Or even if you are not like that, if you grow up in a family where worry is the norm, then you too can become convinced that the world is a more dangerous place than it is. It's not that the world cannot be dangerous, but the ability to sort out where danger really lies, where risk really lies, is a critical part of being able to figure out how to function and handle the world around us. Abnormal anxiety often starts limited, but may generalize. One of the ways of knowing when you should think about seeing a therapist or seeing a psychiatrist is the example of agoraphobia. Agoraphobia is a type of anxiety where people are afraid. Agoraphobia, literally going out to the market, but people are afraid to go out themselves. People are afraid to go out. And often, if you look back, agoraphobia, people don't get up one day and say, I'm not going out anymore by myself. They're walking on the street, or they're crossing a bridge. It's not an uncommon thing. They're crossing a bridge and they have a panic attack. And they say to themselves, well, if I just don't cross the bridge anymore, I won't have a panic attack. So they avoid crossing a bridge. But because the panic didn't actually occur because of the bridge, because of something internal to them, as Rachel was saying, it's an internal issue. It's not an external stress. They have another panic attack when they're on the train. So now they say, okay, so I will not cross any bridges. I'll not go over any bridges. I will not go on the train. I won't have a panic attack. And before you know it, there's more and more of their life that they're avoiding to avoid the panic. And the panic continues and their life shrinks. And that is usually how something like agoraphobia occurs. So if you're feeling anxious about something, and as Rachel said, you have to look both ways. Or if you're in a minor car accident, when you get into the car, you have to buckle your seatbelt. You have to make sure the mirrors are set. You have to practice safe driving. But if you've had a minor fender bender, and everyone, God willing, was okay, and it's only car damage, maybe even not. You get into the car and maybe you buckle your seatbelt a little bit better. Maybe you drive a little bit slower. Maybe for the rest of that day, you drive in the right-hand lane and don't drive in the speedway on the left-hand lane. But after that, it should not extend. It should not get worse. It should get better, and it should not begin to encompass more and more of your activities and more of your issues. So abnormal anxiety loses connection to its trigger, right? It becomes a reaction to any trigger. And Rachel said, before you know it, everything seems to make you anxious. And also there's an issue of catastrophic thinking. It's sort of the anxiety equivalent of if you give a mouse a cookie. There's a book that's if you give a mouse a cookie. When you give a mouse a cookie, it talks about how if you give a mouse a cookie and then, well, this will happen, and then this will happen, and this will happen, and this will happen. Before you know it, you're back to the beginning. Well, in catastrophic thinking, the original concern is reasonable, but then it goes down a cascade to the end. It's very, very abnormal. I have a patient who had asthma as a kid, and one of the physiological issues that triggers panic is being afraid of being smothered. It happens to be, it's a survival mechanism. It has to do with being afraid that you can't get enough oxygen, and it induces panic, literally. So she had asthma as a kid, and so not breathing was something that she had trouble doing. Breathing well was something she had trouble doing, and she became anxious about it, and she developed claustrophobia related to, she said, when she go to the emergency room to take care of asthma, they put a mask over her, and that would be enough. So her asthma was under better control. She had not been into the emergency room for a long time, and she was doing well, except that she needed an MRI. And in those days, they were only doing closed MRIs. And the closed MRI induced an anxiety attack in her and a panic attack in her, and she was unable to complete the exam. She decided that if she had to go back into that, and then she needed a repeat MRI because they thought that she had ovarian cancer. It was actually for a cancer diagnosis. She became convinced in this catastrophic thinking that if she went back into an MRI, she would not be able to breathe, and she'd end up dying of not being able to breathe. So she decided she was not getting an MRI because either she was going to die of her cancer diagnosis or she was going to die of the MRI. So to her, there was no question, she just wasn't doing it. There's nothing like getting a psychiatric consult if you have a patient, if an oncologist has a patient in front of you, and I apologize to any of the oncologists, any of the cancer docs out there in the audience who you think may have a treatable or a curable cancer who refuses treatment. So my patient who refused her MRI, her workup, got sent to my office very, very quickly. So there's catastrophic thinking. And so what is abnormal anxiety, as Rachel said, can manifest in a whole bunch of symptoms: feeling nervous, increased heart rate, breathing, hyperventilation, somatic, stomach aches, back aches. Many of us, we like to think it was only school-aged children, but if we're really honest, it's not true. Many of us have a little bit of a pit in the sort of in the bottom of our stomach on Sundays when we have to think about going to work on Mondays. I didn't say that out loud. I thought it. And there's anxiety because who knows what the day is going to bring, and it can cause sleep problems. People complain about not being able to turn their mind off. They distract themselves. They're busy all day. They get into bed. They're very tired, and all the worries and all the concerns and all the anxieties they have, they've accumulated a whole day, begin to beset them, and they're unable to go to sleep, to fall asleep. Sometimes people are, if they're anxious enough, they worry, at least in the older women population, that they've actually developed dementia. Why? In order to learn something, you have to be able to pay attention. If your anxiety is bad enough, you can't pay attention. If you can't pay attention, you can't absorb information. You can't absorb information. You can't learn it. You can't learn it. You can't retrieve it. You can't remember it, and then you can't retrieve it. And as Rachel said, it can affect schoolwork or infect anything. It can be acute or chronic. In other words, it can, or even be episodic. So there's a condition called performance anxiety. And performance anxiety is episodic, meaning it occurs when you have to perform. Like before we started this, today's webinar, today's podcast, we actually took a survey how many of today's speakers actually get nervous before they have to speak. If it's really severe, people can sometimes require treatment. It can be a standalone diagnosis, such as panic disorder. It can be a significant component of another condition. So for example, as Rachel said, if you have a history of anxiety, you have an increased risk of getting depressed when you're older. If you have depression with anxiety, it becomes harder to treat. It's not that it's not treatable, but the depression itself is harder to treat. And interestingly enough, if you treat the depression, the anxiety abates. And sometimes it's secondary to a medical condition. Thyroid disease, which is more common in women, steroids, other medications. Most of the time, if you have an anxiety disorder, if someone complains and worries about being anxious or a feeling that is alien to them that they still can't control, or anxiety that whether or not it's part of them or seems imposed, like clothes that don't quite fit, but they can't take off. Usually it's not a medical condition, but if someone has new onset anxiety that has no other source and no other obvious trigger, I always think that they should get a medical workup. And of course, being anxious adds to everything else we have. Okay. But the good news is it does respond to treatment. It can be cured if not controlled. And the treatments can often be a combination. The best treatments is often a combination of psychotherapy, wellness interventions, meaning things like yoga, things like meditation, things like some of the things that Rachel talked about, because when you're feeling anxious, it's often a feeling of being out of control. It's very important that you restore some sense of control to your body and some control of your life and sense of control of your emotions. And some of these mechanisms allow you to do that. So what is treatment? It starts with a good assessment, because as we said, anxiety is a word that we use, and not all anxiety is pathological. Anxiety that's self-contained and temporary may not require treatment other than support. And as in the interest of time, I'm not going to reiterate what Rachel said. Anxiety needs treatment when it's too much, overwhelming, too interfering, and does not make any sense. So how do we treat it? The best way of treating it from a psychiatric point of view, in addition to therapy, or once therapy is not sufficient, there are medications that help. One is an SSRI, the Prozac, Zoloft, Lexapro. They're safe. They have what's called the high therapeutic index, which means that the difference between the therapeutic amount and the dangerous amount is very wide, which makes it safe. They're user-friendly, they're easy to use, they tend to have limited side effects. Interestingly thing to note though, if anyone's doctor puts them on an SSRI and it doesn't work right away, don't be worried. These medicines work, but they take a while to work. And it looks, in my experience, it takes longer. They need higher doses and longer for anxiety disorders than depression. The other thing that's often prescribed or asked about are things like Klonopin. Klonopin, old-time Valium, Ativan, those are called benzodiazepines. They're like taking Tylenol or Motrin for a headache. They're probably okay every once in a while, but they're not okay. They don't reset our central nervous system. They don't treat the underlying dysfunction. And it is possible, the same way that if you mentioned a headache, the same way that if you take too much, if you use too much treatment, acute treatment, like Motrin or Tylenol for a headache, you can actually create a headache disorder called rebound headache from the treatment itself. If you take too much Klonopin or too often, and I don't mean abusing it, but if you use it too often and don't treat the underlying physiological problem, then you can cause issues and still not treat your anxiety. And then there was called nutraceuticals. It's a question about vitamins, supplements, CBD oil, SAMe. You need good health is good health. It affects everything. So there are people who do benefit from supplements of various kinds, but I just want to caution everybody, if you go to the doctor and they ask you if you're taking any medicine, please include all supplements and vitamins because they affect everything. It's like traffic. Every car on the road affects how the other cars work. Everything you take, everything I take, everything that has to get metabolized by our liver, whether it's natural, quote unquote, whether it's pharmacological, whether we smoke it, whether we take it as an oil, whether we eat it, however our bodies have to metabolize it in the same set as same traffic lanes. So I just am asking everyone to please make sure they give the whole history. There are drug-drug interactions and there's traffic. There's a question, and I in the interest of time, I'm going to sort of speed to the last comments or two. There are questions about does everyone need to see a psychiatrist? No, everyone does not need to see a psychiatrist. Very often the physician that you will see most often is your internist, your PCP, or your OBGYN. And very often OBGYNs or PCPs start patients on medication. The only thing I'm going to ask is that consistent follow-up is important and can be critical. But a psychiatrist should be consulted if the diagnosis is complicated by patient history or severity or comorbidities. In other words, the more complex your situation is, or your condition is, the more likely you should benefit from seeing a specialist, psychiatrist being a specialist. If symptoms don't resolve after one or two trials, if you try one medicine with your PCP and another and you're still not doing well enough, then you can, then I think it's time for at least to have a consultation with a psychiatrist. And then if the treatment needs to be prolonged or the condition is recurrent. So with that, thank you very much for your attention, and I'll turn the questions over back to Alyssa.
Okay, great. Thank you so much, Dr. Mermelstein. That was so informative. And now we're going to start the Q&A. We're going to do our best to answer all of the questions that we can. And there are a lot of great questions coming in. So I'm looking through them, and I'm just going to try and start from smaller to maybe bigger. And we'll just have our panelists answer them as quickly, but as thoroughly as they can. So the first one is for Rachel. And the question is, what are the different types of anxiety? Like somebody just wanted maybe a list of the different kinds of anxiety that there are.
Okay, so there's a lot. Dr. Mermelstein touched on some of them, but I guess the most common and well-known ones are, like I said, social anxiety, OCD, phobias, separation anxiety, agoraphobia, panic disorders. There's a lot of different forms of anxiety. I think that in general, when we get caught up in like labeling, sometimes we like start sticking ourselves in boxes. So someone will be like, oh, I have social anxiety because I hate going out. When in reality, it's like, no, you might just like hate going out and maybe you don't like socializing, right? So I think that people kind of like get stuck on labels and they kind of want to know like, oh, if I go places and I feel uncomfortable, maybe I have social anxiety. So I think it's just important for us to kind of pay attention to like what myself and Dr. Mermelstein were saying tonight, and less focused on like diagnosing yourself and more kind of paying attention to like, how do I feel? And, you know, like when I'm out with people, do I feel terrified that I have nothing to talk about? And that when I'm talking the whole time I'm in my head, like she hates me, she thinks I'm so stupid. Or if I'm on a webinar here and I'm like, oh my God, everybody here thinks I don't know what I'm talking about. And I never know what I'm talking about. And why am I even here? And when I get off tonight, I can't sleep. And all I do is obsess about what I said. And I play back the recording. And right, I don't have to necessarily like fit myself into a box of this specific anxiety. I just know it's a problem. So I often tell people, please don't get caught up in labels and being specific so that you can go into your doctor and be like, okay, I know I have PTSD, like here I am, OCD, figured it out. It doesn't matter. Just like name your symptoms and let whoever you're going to figure out how to best help you.
Great. So in that same note, can you have both OCD and anxiety? It seems that they overlap a lot. How are they different?
Okay, I'm going to let Dr. Mermelstein handle that question more, but I am going to say that anxiety, OCD is an anxiety disorder, but it is characterized by obsessions and compulsions. And often when people hear OCD, they're like, oh, like I can't stand when my house is a mess. I'm so organized. So like I have OCD, or like I can't stand when my grid on Instagram isn't color coordinated. I'm OCD. That is not OCD. OCD is a severe anxiety disorder where literally, and I've had friends who have had this as well as clients who have come into me, and I've had to kind of send them out to people who are more skilled at treating this and have training for it. But it's literally having scary thoughts that you have then compulsions to behave in certain ways so that these thoughts like don't come true or so that you can avoid them. And sometimes they're morbid and disturbing. And a lot of people think that they are perverted or sick. It's really more than just like germs, and germs can be a piece of it, but that's really not what it is. And I guess I'll give you, Dr. Mermelstein, the time to kind of address it more, but anxiety is that comes up in OCD, but OCD is an anxiety disorder.
Yeah, anxiety, OCD it's again, I don't want to get involved in the label, but they're not distinct. And anxiety is like saying that you have, I don't know, the heart condition. And there are different heart conditions. You know, there's AFib and there's all kinds of different heart conditions. And so if we think about it, it's not an either or. It's an OCD, and people get caught up. There are people that have what's called obsessive traits, you know, that need to be organized, but they doesn't interfere with their functioning. And more importantly, if the situation requires them to rethink how they approach something, they can. They may prefer things color coordinated. They may prefer being very organized. It would be really nice if I was a little better at that. But they can tolerate times when they're not. OCD is a severe disorder where people have either obsessions, which are thoughts that are disturbing and abnormal and irrational, and they can't stop. They pop into their head or they replay them again and again. And compulsions are the actions that you take to magically think that if you know that you're going to protect against something. I can't even describe it. But no matter how much, no matter what the logic is, and no matter what you show someone, what someone knows, they can't stop. It requires treatment. Sometimes it requires very intense treatment because sometimes it veers into the psychotic. I'm not to scare anybody. That's not my point. The point is to let you know that if you have OCD, please just check it out. It's possible to treat. It's possible to improve. But untreated, it can begin to affect things in a way that is destructive over time.
Okay, great. Thank you. The next question was specifically for Rachel, but either of you could answer it. How do you know if your therapist is the right fit for you? And just before you answer that, I think that is an amazing question. And people ask me that all the time. So I would love to hear Rachel's take on this, or Dr. Mermelstein, either one.
Okay, and I would love to hear from you also, Alyssa, because I think, it's also for the people that are in therapy that, I mean, I'm also in therapy, but not just the therapist to tell you, but for people that experience it themselves. But I'll tell you, the most important piece of therapy, it doesn't matter if you are at the foremost expert and the trainer of this kind of approach to therapy or whatever, your relationship is what matters the most. So if you go to a therapist that everyone recommends and, oh my God, they're incredible, and he lectures at this and she speaks at that and blah, 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 and you don't like them, therapy is not going to work for you. I always say therapy is a relationship. It's like a shidduch. It's like being set up on a date. You go and you speak to this person and you see if it clicks. Do I trust them? And it's hard to build trust right away, but when I sit with them, do I feel comfortable? Do I feel like they care about me? Do I feel like they know what they're talking about? Are they easy to speak to? Do I feel like they understand me? Do I feel like they're judging me? And again, sometimes that feeling of like being judged might come from your own insecurity. And sometimes it's really because there are therapists who are judgmental, and, not everyone is perfect. And there are some great therapists and there's some bad therapists. But if you feel judged, or you feel like they're not going to protect your confidentiality, or that that they don't know what they're doing and that they're not honest about it, or that they're forcing their opinion on you, or that they're dictating to you, or that they're telling you what to do, right? Making decisions for you, or telling you that your decisions are wrong, right? That's kind of like the red flag of like, what, this is not a person for me. So it's really just feeling like they respect you and they hear you and you feel safe with them and you like who they are as a person. And again, sometimes there might be times where you don't feel comfortable to bring up things in therapy. And that doesn't necessarily mean it's the therapist, but I would say, is it because of the therapist that I feel uncomfortable? Is it because I feel nervous, because I want my therapist to like me, or I feel ashamed of the secret? So it's really like trusting your gut. And if you're someone who has a hard time trusting your gut, because maybe that's why you're in therapy, because you've never learned how to listen to your gut, really, I would say just give it time and see, like, do I feel like I'm getting anywhere? Do I feel like I'm making progress? And again, not leaps and bounds, but like I'm talking and I'm starting to understand myself more. And I really respect what this person says. I feel like they're smart and they get me, right? So again, even if you don't get yourself, you feel like someone else is getting you. I think that's the most important piece.
I just, if I may, I would like to just add, absolutely, the most important, study after study will tell you that the most important factor in successful treatment to what's known as the Therapeutic Alliance, actually the relationship. But I'm going to make one more. If things are not going well in therapy, you're not sure you're not sure trusting, raise it with the therapist. Don't just leave. Because a therapist that is good at what they do and good for you should be willing to discuss this. And it is like a shidduch. You can't always predict, but someone who's not comfortable with that question is not someone that I think that you should be comfortable with continuing to see.
Okay.
That's just a plea.
Thank you both. I couldn't have said anything more all-encompassing myself. So I'm going to go on to the next question. Thank you. So this is a good one. How do we help our children with their anxiety? And in that question, I'm just like looking for it. My whole thing just got, hang on, give me 2 seconds. How do you know if your child has anxiety? How do we help our children with anxiety? Yeah, just sort of like children and anxiety in general.
So, I mean, I think that something to pay attention to, again, is kind of like what Dr. Mermelstein was saying also earlier, is that sometimes kids have like a disposition to be a little bit more sensitive. So if you have a child who's highly sensitive, maybe even sensitive to noise, a little bit shy, they're more likely to be like your anxious kid. And I think that parents sometimes will, if you are an anxious person yourself and you see it, that might kick up your anxiety and you might be free. Oh, I don't want them to be like that. And, you know, you might start getting into that like mode of like trying to calm them down or reassuring them nothing bad will happen, or, you know, and I think that parents kind of get stuck in that cycle where they're trying to like reassure them and like take away their fear. And that's actually only making it worse. One of my kids has anxiety. And I remember I don't have, I mean, I never thought I had anxiety, but I started getting it when she was anxious, because I would get anxious about her anxiety. And I would always, you know, she would get upset about something and I would always like give her, you know, be like, oh, this, that, and the other thing. And one day she said to me, she was 11 years old at the time. She's like, Ima, every time you try to make me feel better, you just make me more anxious. And I was like, why are you a therapist, kid? Right. But she was right. Like I kept trying to like fix it and like rationalize and explain it and make her, what are you scared? Can I show you that how many airplanes crash in a year and why it's safe and blah, blah. And she was like, I literally don't care. Like the logic is not helping me, you know? So like, it just goes to show every therapist, right? The shoemaker's kids, like I wasn't doing well with her. So I think that we just need to pay attention to giving them skills, not reassuring them, helping them to get curious about their anxiety, ask them what would be helpful, help them journaling, getting them to therapy if you can. I actually have a book here that I used for my daughter. She was in therapy, but I also used it for her, just for us to read. It's called Anxious Kids and Anxious Parents. It's a great resource. You can get it on Amazon. If you're in the 5 towns, I'm pretty sure it's at Blue Door Books, a really great book. And then another one is The Worry Trick. There's such a fantastic like insight into how the brain works, the worry brain, and really giving you the tools, this one especially, really giving you the tools how to deal with your child's anxiety, what not to do, what to do, what to say, what not to say, and even like some exercises that you can give your kids to help them navigate their anxiety. And that's what we want, by the way. We don't want our kids reliant on us to deal with their anxiety. We want them to be able to handle it themselves and to have those skills and to be able to be their own advocate and their own therapist. So I think that those are some good resources for parents if you have a child who's struggling.
Dr. Mermelstein, anything to add there?
I just, the only thing I would add is again, there are children who are normally a little bit more anxious, and it's important to, certainly to respect if there's a problem, but also not to over pathologize, because that's the other, there is that other part of the spectrum. And yes, I can agree with Rachel more. If you have a child that struggles with any condition, including anxiety, then your job as a parent is to help them manage what will likely be a lifelong issue, to help them develop skills and help them learn how, and reassure them that they can do well and it will be okay. Even if you can't fix it, you can't fix it for them, but they can learn how to take care of it themselves.
Yeah. And one final thing, I always say the goal is not to make them not be anxious. The goal is to help them learn to deal with their anxiety.
How to handle, no different than any other condition.
Yeah.
I think in general, about feelings and emotions with kids, I'm not a professional, but I talk about this a lot online. I just think it's so important to open those lines of communication about emotions and feelings in general with our children. My kids are young still, they're only 4 and 5, but we talk about our feelings all the time. And I'm not making some claim that talking about your feelings and emotions younger will like prevent anxiety. I'm not saying that. I'm just saying that I think in general, it's so important to open those lines of communication and make it a normal thing to talk about. And then anything you do have to, battle down the road will just be that much easier and more normal to handle, I think.
Giving the children permission and letting them know that it's okay. They don't have to be embarrassed, they don't have to be ashamed, they don't have to be worried to sharing with you.
Right.
Because if they can't share with you, they can't get the help they need or organize what's going on.
Yeah. And giving them the vocabulary to kind of like
That's
identify
right.
their emotions and feelings. Totally. And a big part of dealing with anxiety is being able to talk about it. So if I can talk about how I'm feeling and I can understand it, and there's someone there who's going to not try to fix it, but validate and say like, yeah, you know what, that was hard. You weren't expecting that, or that stinks, or that feels scary for you. That's so powerful. So yeah, maybe it, won't prevent anxiety from developing, but it'll help them learn the tools to manage it. So I think that is such an important point. Thank you.
Okay, great. So moving on, what are some cognitive distortions one can look out for to know if their thoughts/anxiety are disproportionate?
Okay. A good example is, Rachel was talking before, a very, very common one is very common. People complain about social anxiety. It's because they are sure that everybody, like when you tell your kids that everybody doesn't do that, they're sure that everybody doesn't like them, or everyone's going to find out who they are, or everyone can see through them, or everybody. So a very good cognitive distortion, a very, very common cognitive distortion in anxiety is everybody. That's one. Two is, it's a very curious thing. We learn, we think of ourselves as people that we learn from experience. I hope I'm a better driver now than I was when I first started, because you take experience and you learn from it, and you absorb it and you change, you modify. In those areas that we are in conflict with, those areas that make us anxious, those sources of them, we protect it. We don't learn from experience. We don't let experience, people who have I'm using social phobia because it's not uncommon complaints. People are able to say, no one's going, I can't possibly succeed at the job interview. I can't. So you succeeded at your last 10 job interviews. You've never gotten fired. You never got. So what makes you think that this is going to be different? What I'm trying to suggest, inelegantly in too many words, and I apologize, is that rather than list what the cognitive distortion is specifically, some clues: everybody, always, never, the absolutes that come and characterize it. And the fact that when the statements are stated as an absolute, in spite of experiences to the contrary, patients will say to me that, they believe all criticism, they don't believe any compliments about themselves.
Yeah. I was going to say probably the most common cognitive distortion we have, a lot of people here, is I'm a terrible mother, right? I'm a horrible friend. Or, you know what, even if you're like building a bit, I'm like terrible at, if you're someone who builds a business on social media, I suck at social media. I'm just the worst. Look at her. She's so much better than me. So I think that we do that. I'm a terrible partner. I'm a terrible daughter. I'm a terrible wife. So I think those are cognitive distortions, because I think objectively, probably most people here, maybe there's a couple terrible ones, just kidding. We're not terrible moms. We're all trying our best, and we love our children, and we want to do good by them, So I think that's the most common one that we don't pay attention to, that we think it's just normal. Like, oh yeah, of course I'm a terrible mom. I don't know what I'm doing. And it's like,
we don't accept the idea that of good enough, actually.
Yeah. And it's kind of even like dichotomous thinking, right? Because when you say I'm a terrible mom, there's no in between. It's either I'm like super incredible, amazing, or I'm like horrible and the worst in the whole wide world. And it's like, no, it doesn't have to be.
It's the absolute ends.
Yeah. Like good enough, and trying to be better constantly. Like that's pretty awesome. But we think that's like normal to think that way. Like, oh, of course I'm a terrible mom and everyone's better than me. So I would say that's, not necessarily you have to go to therapy for that, but I would say pay attention to that and maybe work on that. Like, why do I tell myself that? Where is that coming from? And challenge that thought. So those are some cognitive distortions that I think we just experience every day. And those are important to pay attention to.
Great, thank you. On that same note, what if your triggers are not something that you can avoid? Any advice?
I guess the question is the same thing like with the children, just the problem with anxiety is that anxiety is a survival mechanism. We talked about it being part of us. So it's like the difference between alcoholism maybe and eating disorders, if I may for a minute. Alcoholism, you can avoid alcohol. Theoretically, you can avoid alcohol, you never have to have it. Eating disorders are a little trickier because we all have to eat. So you have to learn how to handle the situations that come up with eating for you. And the same thing is true. Anxiety is part of us. It's part of what we need to have a little bit of. And so learning how to handle those triggers, even if you can't avoid them. Most of us can't avoid all the triggers that we have that set us off. But it's a question of how to handle them, developing a psychological toolkit, developing our own self-care models, developing kind of medication, developing, anxiety. It's sort of, as Rachel said, there's always some, the amygdala triggers the adrenal gland, and fight and flight gets triggered, right? And what happens if there's really no threat? Where does that go? Sometimes I think that the way I explain it to patients is that there's energy that collects there that has no place to go. So taking a walk, doing exercise, doing something to let that energy dissipate is often very helpful.
Okay.
So it's managing the triggers if you can't avoid them.
Right. Thank you. Okay, next question. Sorry, I'm just trying to get through a bunch of questions in as little time that we have. Let's just talk about postpartum anxiety for a second and how long it can last, generally speaking, treatment differences, if anyone feels able to answer that.
Rachel, do you want to start?
So postpartum anxiety, I know a lot of people think that postpartum is only like within the first year, and characterized by like very, only things like related to baby, but postpartum anxiety, I'm pretty sure they say now it can be up to 3 years post-baby. And correct me if I'm wrong, Dr. Mermelstein, but it doesn't have to be just related to mommy and baby things. And I think a lot of the time what happens with postpartum is people just think like, and this does happen, sometimes they'll go to their doctor or they'll talk to their friends and they're like, oh, you're just tired and stressed, new baby stuff. And so people kind of miss the signs of something that's actually problematic because they're kind of like poo-pooing how they feel because they think it's normal, just normal new mom stuff. And so I say whenever, after you have a baby, if you're feeling overwhelmed, if you're feeling super emotional, if you're feeling, any of the things that we talked about tonight, like in your head, I'm the worst mother, I can't, or even hating your baby or not liking your baby or not liking yourself or not wanting to be around, or, again, it doesn't even have to be that extreme. It could just be like, like everything feels so heavy and hard and I'm exhausted and whatever it is, don't just assume it's because you're waking up every 2 hours. I would say speak to your doctor when you go for your checkups, like talk about it, say, hey, I'm feeling like super overwhelmed and this is how I'm feeling. And again, even if it's a year out, a year and a half out, 2 years, even, don't just like chalk it up to like, oh, I'm just like a tired mom who doesn't have her act together. Speak to someone about it because it's a very real issue that we see often. And again, there's not enough talk about it because I think, like I said, I think people are just like, oh, it's just like being a new mom. And so we don't take it as seriously as we should until it's really like, we're looking at someone who is feeling suicidal or wants to hurt their baby. And it doesn't have to be that extreme for you to get help. It shouldn't have to be. So speak to your doctor if you're feeling any kind of overwhelm. And ask for resources. Again, you don't need a diagnosis of postpartum. Just, I'm not feeling great. And even if this is how I'm supposed to feel, I want help. I think that's important.
I mean, most of the time, what Rachel's talking about is actually a form of depression. And it's not, people are anxious and agitated and restless, but it's actually a form of depression. And the good news is that it responds to treatment very well. Really, the other reason, even if it's not as extreme as, I saw a woman the other day who 7 months, she's been schlepping herself because she was sure that and she she tells me, I love my baby, but I'm not connected. She's so depressed. She's so turned inward. She's having a hard time connecting to anybody. Her baby is fine. I wanted to make sure everyone was fine. Her baby is fine. She's taking good care of her baby, but she feels so badly about herself. It's really impeding her ability to enjoy and recognize what a good mother she is. So the good news is it occurs maybe in 10% of women, maybe 10. OBGYNs are the place where people, when you go for your checkup, you're going to see the OBGYN first. Tell them, please.
Yeah.
And the good news, the helpful thing is that it responds to treatment very well. It doesn't. The other thing to know is that it doesn't necessarily happen with every child.
Right.
It's mainly people who have people who've had very severe PMS, people who tend to respond, have tremendous depression or anxiety around the time of their period are more vulnerable, because it's actually the change in hormones from pregnancy to delivery that sort of sets that off. And people with a family history of bipolar disorder are at very, very high risk. So please just trust yourself, know yourself. Know that if something doesn't feel right, ask about it. We're telling you to teach your children to discuss it. We're asking you to please give yourself permission to do the same.
Great, thank you. Okay. This is a different topic. Would a poor reaction to one SSRI mean that you may not respond well to others?
The answer is yes and no. SSRIs are like siblings. They share a lot of characteristics, but they're not exactly the same. So the general rule is to try 2 or 3 medicines in the same group. And if they don't work, then you can go to the next level. So maybe, but not necessarily.
Great. Okay, this is a little bit more of a detailed one. As a busy stay-at-home mom who thankfully has not had COVID yet, but is vaccinated, is the fear of getting COVID a rational anxiety? She says she feels like she doesn't have the option of being sick because no one would take care of her, and she can't handle being stuck at home with the kids for 2 weeks. So is that a rational anxiety for people to have? I think that's a really legit question.
Again, from what you're describing, it sounds completely rational. Like it makes perfect sense. Like I was getting stressed listening to that situation. Like, yes. And that's something we have to think about also. Certainly, like, during COVID, we always say like every response during COVID is a normal response, right? Because we're just living in this crazy time. And so I think here, feeling nervous about that when you know that, you don't necessarily have the supports, or that your life could be turned upside down. And it's valid, right? If we know that, shoot, this kid isn't going to be able to go to school, and then I can't go to work, and then this one can't go to work. This is it makes sense. So I would say, yes, that is a valid concern, and feeling anxiety about that is totally normal. But then I would say, but then how is that anxiety manifesting, right? So are you constantly like, every time your kid coughs, you're like, oh, okay, we got to go get a test. I can't, like, how is it manifesting for you? Are you constantly taking their temperatures? Are you losing sleep over it? Are you worried? Are you keeping them from play dates because you're so terrified that they might catch it from a friend? You're not letting them go anywhere. You're not going anywhere. We want to just know, how is it really now impacting your life? Or is it just something that's kind of like on your head where you're like, please God, like everyone just needs to be healthy. I can't deal with this right now.
And the other thing is you need that. And the other thing I think is helpful when you're in the situation is if you give yourself some sense of what will allow you to feel better. If the infection rate goes down to 1%, will that allow, you organize it for yourself. Give yourself some ability to use your normal resilience and skills that you do with every other situation in life and any other risk of life, and apply this here so that you can move forward, and you can also know that it's not you.
Great. Okay. When you're dating, how do you know if the boy's level of anxiety is normal or something you should be alarmed about?
Okay. This, this is like a tough one. That's something that I would think that would actually be great to talk with a therapist about, because you really have to get into like the details of how it's manifesting. So that's not something that I could really answer right here and right now, but I would say you need to talk about it more with someone, so that a professional, so they can kind of get a sense of like what's happening with his anxiety. Like, is he someone who just tends to worry more, and is it more sensitive? And, is someone who's kind of like, more, like I said, like just worries, or is it something that could be really, really be a problem? That's hard to answer right here for me, though.
Yeah,
Maybe-
it's very, very hard to answer. It's also hard to answer, it's always hard to answer those questions. What do you do if you're dating somebody who has anything, any kind of condition? What does it look like? What does it mean? What impact will it have on your relationship, on your life? And what is your own tolerance level, honestly? That too, so if someone has a history of OCD and it's well controlled and they're compliant, is that something that is okay with you? You have to, all of this, it's not a matter of fair, it's not fair, it's your life. So talk to a therapist, talk to the doctor. The fact that, and also what's not clear is whether or not you know about this problem because you've observed the signs or because they told you. All those things go into any of the decisions. So it's not a podcast question.
Yeah. And I mean, kind of just what you were saying, just elaborating a little more. If they are having anxiety and, it is something that's like a problem, like, are they managing it? Are they in therapy? Like, then it's not your problem. Like, as long as they have it under control and they're open with you about it, like, yeah, I have anxiety, but I see a therapist and I take medication if I need, and I'm open about it. And like, it's something I've been dealing with. That's different than someone who isn't even self-aware, isn't getting help, doesn't, when you bring it up, they're like, what are you talking about? It's so different, so complicated.
Okay, great. Thank you so much. We're going to wrap up. Thank you again to our speakers, Rachel Tuckman and Dr. Hindi Mermelstein. And thank you to Dr. Jacqueline Sigelnik, Dr. Mimi Nall, Julie Wilcox, Jewish Association of Physician Associates, and OJNA, Orthodox Jewish Nursing Association, for organizing this event. Most of all, thanks to you, our audience, for taking the time to learn more about ways to treat anxiety and take care of your mental health. We are so happy that you asked so many questions. We apologize we couldn't get to all of them tonight. Stay tuned for JOWMA Wellness's next newsletter, which will include some remaining questions and answers. All registrants tonight are going to be added to the list to receive it. We ask before you sign off that you please direct your attention to the screen to complete this post-session survey so that JOWMA can improve its ability to modify future webinars to your needs. There's also a link in the chat box that will take you to the survey directly. You can just scan this QR code that's on your screen right here. If you fill out this survey, you'll be entered in a raffle to win a $50 Amazon gift card, and I don't know who wouldn't want that. The survey is completely anonymous. Don't forget to follow JOWMA_org for more information on future webinars and events. Thank you again so much, and have a good night, everybody. That's it. Happy World Mental Health Day.
Thank you.
Night, everybody.
Night.